Hey everyone, it's me, Dr. Whimsy. Today we're going to be talking a little bit about something that I call menopause belly. Menopause belly. Menopause belly is a condition that I see quite a bit in my offices, and it usually begins to show up after the age of 30 in women. And there are a couple of symptoms. Who is going to get menopause belly? What is it, and how do we treat it? As we get older, I've started to notice that many of my patients suffer from digestive upset. As a person ages, we're just going to talk about the female patient over 40. We may see an increase in gas, bloating, upset stomach, sometimes gastroesophageal reflux disease. And we will also see an increase in abdominal fat, that fat that begins to develop in the abdominal area. That is associated with elevated cortisol and resistant weight loss, but we also associate abdominal fat with chronic diseases that have us concerned, like type 2 diabetes, also increased risk for coronary artery disease, and even cancer. Those are some of the health challenges that can begin to develop as we see an increase in abdominal fat. I would go so far as to say that as abdominal fat increases, the disease process increases. Now, if you are under the age of 40, you could be experiencing early perimenopause. I've had patients come to see me who went through complete menopause as early as their mid-30s and began showing symptoms of perimenopause 10 years before, so in their mid to late 20s. It does happen. So if you are concerned that you fit into that category, then this video is probably right up your alleyway. So that is the symptom picture for menopause belly. We're seeing an increase in abdominal belly fat, fatigue, depression, and accompanied with that abdominal belly fat, we're seeing gas, bloating, upset stomach, food sensitivities, food allergies. What the heck has happened? Why is my stomach and my digestion falling apart, and why am I gaining weight even though I don't eat very much? Those are really the things we see when we see this condition, menopause belly. So what are we going to do about it? Well, the first thing that we talk to people about, of course, is seeing a doctor. I would recommend that people get an annual exam, get a baseline, find out how you're doing in terms of your health. Get a good naturopathic doctor, hopefully somebody in your area. You want to make sure they've actually gone to medical school and do have medical training. But what I am finding when I build programs for people who are suffering from menopause belly is that people want their programs to be as precise, as clear, as to the point as possible. And so I'm usually able to do that for them. So we start with a process of elimination when we are trying to heal the digestive tract. We know that certain foods can certainly aggravate digestion, and we think about the top foods that are going to cause digestive upset. Those are the ones that we pull the first. Now, there's been a lot of conversations on the internet over the last couple of years about small intestinal bacterial overgrowth. And that is because as we age, we also see a decline in pancreatic function. And with a decline in pancreatic function, we may start to see an elevation of bacteria in the small intestine. So that may also be part of the symptom picture we see in menopausal women who have digestive upset. But when we're talking about eliminating foods that can aggravate digestion, the first on the list is going to be sugar. We want to start pulling any foods, processed foods that contain sugar, corn syrup, and even some of the synthetic sweeteners. I'm not a fan of NutraSweet. I'm not a fan of saccharin. I'm not a fan of any of those chemicals. I'd prefer a person, if you want to sweeten something, stevia is fine. Xylitol may be fine if you do not have SIBO, but we'll just go ahead and say stevia should be fine. Some people do fine with a little bit of coconut sugar, but like anything in life, it can be overdone. I like coconut sugar because it has a low glycemic index, and it's a good transition food if you're struggling getting off sugar. So sugar is the first thing we pull if you suffer from menopause belly. Second thing we pull is wheat, gluten. All gluten-containing foods, but if you can't give up all gluten-containing foods, at the very least, start with wheat. And that is because with modern wheat, we're seeing a lot of allergies, and they can develop slowly over time. You may not even know you have a gluten sensitivity. You may not be feeling gas, bloating, and upset stomach when you eat gluten, but you may be incapable of eating high-fiber foods. You may be incapable of eating high-fiber foods because your stomach, your digestive system is inflamed and irritated due to gluten, and that is why you are having trouble with high-fiber foods. We find that when people give up the gluten, when they give up the wheat, they are able to better tolerate those foods that are high in fiber. If you have undiagnosed celiac disease or celiac disease that has developed later in life, it could be because you have a genetic component, because celiac is an autoimmune condition. But it could also be, in addition to genetics, that it was triggered by something like, for example, a virus. Viruses can definitely trigger the type of autoimmune condition like celiac that we see develop later in life. A person may not even know that they have celiac disease until a virus or some other event happens that triggers that autoimmune condition. Now, if you don't have celiac disease, you might still have a wheat allergy. An allergy is not a celiac. Celiac, again, is an autoimmune condition. An allergy is where you're actually allergic to something that's found in the wheat itself. It can be one of the proteins, it can be the bran, it can be any component, not just the gluten that's found in the wheat that's leading to an allergy. And you guessed it, the symptoms are very similar that you might be seeing in Crohn's disease: gas, bloating, upset stomach, but you'll also see abdominal weight gain, itching or hives, sometimes swollen lips, a migraine headache. You can be tested, of course, for all of these. If you want to be tested for celiac disease, we check for the autoimmune markers. Those are the gliadin antibodies, and doctors will often prescribe what's called an endoscopy with biopsy as the gold standard for determining if you have celiac. Now, on the other hand, if you've got a wheat allergy, we'll do allergic testing or IgE testing, and if we see that the antibodies have increased in the presence of wheat, if you do the IgE testing, then we will know you have an allergy to wheat. Now, wheat sensitivity is by far the most common reaction I see in my office. It's not a full-blown allergy, it's a sensitivity, and again, same symptoms: gas, bloating, upset stomach. So that is why we pull wheat, sugar and wheat, when we're trying to heal menopause belly. The third thing I pull is commercial meat. I really try to get my patients off meat as much as possible. If you're not able to be 100% vegan, or you're simply not willing to be 100% vegan, plant-based, that's fine, but we really want to reduce animal fat, animal products. I know there's a lot of false information on the internet, but the truth of the matter is, when we look at coronary artery disease studies going back 30, 40 years, when we look at heart health, when we look at longevity studies, we're really seeing populations, with rare exceptions, that consume very little animal products. Before I became a doctor, I was an anthropologist, and so I do study different communities throughout the world. Medical anthropology is an area of study I'm very familiar with. And we really do see that the longest living people in the world can get to about 90% plant-based. And then if they are having animal products in their diet, it's going to be lean animal products and fish like salmon. The longest living populations in the United States probably were the Nez Perce, which was a community that lived on the Columbia River Gorge. They made contact with Lewis and Clark in 1805, and they were known as the salmon eaters. They were 90% plant-based and about 10% salmon and lean animal protein in the diet. They did very well on that diet. What's interesting about the Nez Perce population, as a side note, is that they were living nearly twice as long as the average European on that diet. And needless to say, Lewis and Clark, when they made contact with that community, were pretty impressed by how long those folks lived. So that is why we reduce animal products. Also, animal products can be washed with bleach, which can be very hard for the digestive tract. They're also injected with antibiotics, which is also hard on the digestive tract. So if you're not eating sugar, if you're not eating foods that contain wheat, if you are not eating large amounts of animal products, what are you eating? Well, we talk to people about the GABAMs. That's the greens, beans, onions, mushrooms, berries, nuts, and seeds as the base of the diet. Whole grains, we recommend the quinoa is one of the best whole grains out there. It's more a seed than a grain. Also organic brown rice in small amounts. But really you want to get most of your calories from fresh fruits, vegetables, nuts, seeds. If you feel you need more protein than is recommended on a vegan diet, egg whites can be quite helpful and won't elevate your cholesterol. Skimmed milk is fine. Some of the cheeses that are lower in fat can be fine as long as you're okay with dairy. I don't automatically pull dairy unless a person has a sensitivity to dairy or if they have a past medical history that I think they shouldn't be on dairy. But most people, unless you have a lactose intolerance, can do a little bit of skimmed milk or low-fat unsweetened yogurt or the lower fat cheeses. And so that is the diet. We put you on low fat, mostly plant-based. We pull wheat, sugar, and red meat, fatty meats. I also tend to like digestive enzymes, and I will prescribe those to my patients to take a plant-based digestive enzyme prior to meals, and a good quality probiotic, probably first thing in the morning at breakfast, works as well. In addition to all of that, I will definitely do some hormonal testing to determine if my patient needs any bioidentical hormone replacement therapy, and a good multivitamin and multimineral is never a bad idea if you want to add that as well. All right, I want to thank you for watching this quick video on menopause belly and how I treat it in my office. If you'd like to find out more about my work, you can go to drwhimsy.com, or if you'd like to find a licensed naturopathic doctor in your area, one that's gone to medical school, you can go to the American Association of Naturopathic Physicians, and they'll find you somebody that's well trained and is willing to help. If you'd like a general coaching appointment with me, you can do that by going to drwhimsy.com and clicking on my services page and scheduling for a telemedicine appointment. I want to thank you for watching this video, and we'll see you next time. Take care. Bye-bye.